Did you know that while we have come far in understanding the importance of bone health, people with spinal cord injury still experience fractures? Hi, my name is Wendy Murphy, and this is the final episode in the series, episode 9 of the Bare Bones podcast, Directions for Future Research. Joining me is my colleague, Anita Kaiser, who has over 25 years of experience living with spinal cord injury. And our guests, Dr. Jenny Karatley, Director of SCI Clinical Research in the SCI and Disorder Center at the VA Palo Alto Healthcare System in Palo Alto, California. And Dr. Fran Weaver, a research career scientist at Hines Veterans Administration Hospital and professor at Parkinson's School of Health Sciences and Public Health at Loyola University in Chicago, Illinois. I'd like to welcome you both to the show today.
Thanks for having us.
Now, I'd like to begin by asking you both, in reviewing the available research, what changes would you make in the overall designs for the studies? Dr. Karatley, we'll begin with you.
Well, I wouldn't say changes exactly, but rather what is needed for advancing what we already know. Most of the available research has been done with small samples at single institutions. We need to be conducting studies with more people with spinal cord injury at more sites. This will give us both stronger evidence because of the larger sample size, as well as information about other factors that may influence bone health. That is, are there differences due to race and ethnicity? Do women with spinal cord injury lose bone differently or respond to treatments differently than men? The vast majority of the research that's been done has focused on men with spinal cord injury, and there's a great need for more work to learn about women, especially in the area of bone health. Many of the studies have also been exploratory and may not have had a control or a comparison group. Studies like this are a great place to start, and we definitely gain useful information, but we need to move forward with more rigorous designs such as randomized controlled trials for treatment and larger multi-site studies with more diverse study populations, as I've said. It's also important to standardize outcome measurements, such as including scans of the knee where fractures are most common, and measuring certain blood biomarkers that give information about skeletal activity so that results of different studies can be compared. In addition, new measurement techniques are becoming available to look at the internal architecture of bone, and we need these studies to better understand how and why fractures are occurring.
And Dr. Weaver?
I would add that it is also important that we measure the effects of a treatment long enough to determine if the treatment is effective over time. Oftentimes, studies stop measuring outcomes, which are the effects of treatment, like the amount of bone loss or how many patients experience negative outcomes like fractures, too soon. And we don't know the long-term effects of the treatment, like does the treatment wear off over time? Further, those who are measuring the outcomes should not know which group a research participant is in, so any biases they might have about whether or not the treatment works does not affect the findings. We call this blinded assessment.
Nice to know you don't realize how much is involved and all the different components when conducting research until you're actually doing it. So thanks for sharing that information. Now, I know your expertise lies in different areas, so I'm curious, after reviewing the existing data on bone health and osteoporosis for individuals with spinal cord injury, have you identified any gaps that should be targeted as areas for your future research? And Dr. Karatley, we can start with you.
Thank you. Well, we still need to better understand what causes bone loss after SCI and the risk factors underlying fractures, so we can try to prevent the loss in the first place, as well as minimize occurrence of fractures. And we need to know more about aging effects on bone, especially as people with spinal cord injury are living longer. But probably the biggest gap is regarding treatment of bone loss and osteoporosis in people who live with spinal cord injury. There are some recent encouraging results for drug treatments, but we need larger studies, as we've already talked about, as well as long-term studies once we do find drugs that are effective. We also need more studies on the specific elements of potential treatments. For example, what are the most effective settings for functional electrical stimulation, or FES, exercise? And how many times should you do it per week? And for how many weeks or months? What about combination treatments? Will the bone respond better to a drug therapy plus FES? And what are the additive effects of nutritional supplements? Do different people respond less well to some treatments, and why? Identifying and testing the most effective treatment or treatments is a high priority for clinical research into bone health, and there are still many unanswered questions.
How about Dr. Weaver? What are your thoughts?
I think it's important to collect information about a person's bone density soon after their spinal cord injury so that we know where they're starting from. Do they already have some bone loss at the time of injury so that we can account for that as we do our measurements? Measurement of the density of the bone should be done in the areas of the body that are most likely to fracture in the future. For persons with spinal cord injury, this is around the knee, the distal femur, and the proximal tibia, and using a DEXA scan or a QCT scan.
Now, you've both offered some great information about future research. Are the outcomes of the study sufficient, or is there room for improvement?
There's always room for improvement. In addition to reducing the risk of bone loss and fracture, it is also important to consider how the treatment affects the patient's quality of life. Medication side effects may be very unpleasant. Patient preferences for what they hope or expect to get from the study should also be considered. There may be trade-offs. For example, choosing to treat a leg fracture conservatively, that is, with no surgery, may reduce the risk of undergoing surgery, but the result of not having that surgery might be that the patient can no longer get down on the floor to play with his young children. This actually happened to one of our study participants.
Yeah, it's nice to know, you don't realize all the other things that you need to take into consideration. So how can someone with a spinal cord injury like myself help in future research studies?
You can participate. Look for research studies that are available in your area and find out if you qualify. And if you do, sign up. Some studies may be treatments or therapies, but others may be about causes and risks, involving questionnaires and review of your medical history, or sometimes blood draws and imaging of your skeleton, as Dr. Weaver said. Researchers need you to volunteer to help in our studies. We also need you as partners, contributing to the design of studies and helping to generate the most important questions that we need to answer. I've actually gotten many of my ideas for research projects from talking to the patients in our center. In fact, there's a great organization called the North American Spinal Cord Injury Consortium, or NASCIC, that has developed a training program specifically for people with SCI and their families and caregivers to learn about clinical research and how to become involved as active collaborators with the research teams. If you have the opportunity to get involved in research, both as a participant and a partner, you may or may not get direct benefit from the study, but you will definitely be benefiting other people with SCI.
Participation definitely sounds key, and I hope our listeners take this to heart. Now, how can individuals like myself with spinal cord injury better incorporate these guidelines into a healthier way of living?
Well, the most important thing really is prevention. Be aware that you are likely to lose bone mass after your spinal cord injury, particularly in your legs. That leads to increased risk for having a fracture. So you can be just a bit more cautious so you don't catch your foot in a footrest and twist your leg during transfers, or double check how stable you are in your wheelchair to avoid falling, as these are two of the biggest causes of fractures. Another risk can be pulling too hard on your leg during stretching for range of motion. And healthy bones need calcium and vitamin D and a bunch of other nutrients. People may not realize that your skeleton is always regrowing and repairing itself, even when there's bone loss, and it is essential to maintain a healthy diet so your bones have the building materials they need. If you can get advice from a dietitian or a nutritionist who specialize in spinal cord injury, that would be great, but there is plenty of information available on the internet related to diet for bone and health. Also, a lot of information in the recent clinical guidelines. Keeping active is also important, and there's good research showing that functional electrical stimulation, or FES, can help prevent bone loss. You should definitely explore if this is available, but it's not a quick fix, and you have to follow the program for months or years to have an effect on your bones. Finally, there are some drugs that are showing promise for the SCI population, although the research is still being done and there's a lot to learn and understand about who will respond and what are the side effects and long-term results. Just be aware that research is a slow process. That is, each study can take years to get the results, and treating bone loss is a slow process too. The new clinical practice guidelines is a start that will evolve as new evidence is added over time. So you should talk with your doctor and care team and ask questions about new research so you can be informed about your choices.
Thanks for these great tips and advice, Dr. Karatley. So to wrap things up and end off this series, Dr. Weaver, what would be your final message to our listeners?
Please help us by partnering with researchers and persons living with spinal cord injury to reduce fractures and for people with spinal cord injury.
Thank you both. You've given us some great insights on future research. And if you found today's talk interesting, check out our action planning tool on the website at www.scifragments.ca. And feel free to send us your feedback using the survey provided on the website. Thanks to our special guests for sharing their time and expertise with us. Special thanks to the Paralyzed Veterans of America Education Grant Foundation for funding the Bare Bones podcast. Funding support for the development of the clinical practice guidelines were provided by the Paralyzed Veterans of America, the Department of Defense grant number SC 150092, and the University Health Network Foundation.
The Bare Bones podcast is produced by Dr. Kathy Craven, Dr. Hope Jervis-Rademeyer, Anita Kaiser, Wendy Murphy, Dr. Lynn Bogue, Dr. Masai Miyatani, and Lindsay Blencoe. This project team is affiliated with the University Health Network in Toronto, and we appreciate the feedback from people with lived experience who acted as podcast reviewers and helped us to refine the podcast content over time.